great Rocky Balboa once said, "Every champion was once a contender who refused to give up." One of the physicians at Lahey Hospital is bringing that champion attitude by dressing up like the famous fictional boxer to motivate the staff as they battle COVID-19.
In patients that are champions, you know, every champion is a contender who refuses to give up. And that's what I'm seeing here every day. And when they're having a tough day, what you got to tell them is, it ain't how hard you hit, it's how hard you can be hit, and keep moving forward.
Coronavirus has crept into all aspects of our lives and has even infected our street art. In England, famed graffiti artist Banksy's girl with a pierced eardrum got a pandemic-styled update with a surgical mask. We don't know if Banksy was the one who did it yet, but the guy is so mysterious he doesn't even show his face. He could be anyone. He could even be me. Here's a question: how do you quickly and efficiently disinfect an entire town? Answer: snow cannons. Firefighters and sanitation workers in the Italian Alps took a snow cannon off the ski slopes and are driving them through towns to spray hydrogen peroxide. The cannon disinfected roads, walls, and buildings, and this is while the country is preparing to open up more in phase 2 of their lockdown. Also, if you needed a reminder after Thursday night's White House press briefing, don't put disinfectant in your body. Listen to Lysol. Another person you should listen to is Sue O'Connell. She has some important information on the difference between being asymptomatic and pre-symptomatic. Something important to know as we all work together to slow the spread of the virus, so take it away, Sue.
Experts have been working really hard to let you know that COVID-19 is not the flu and not the common cold. And I'll say it again, not the flu, not the common cold. But I want to look at those two illnesses that we're familiar with so we can better learn about the term asymptomatic and pre-symptomatic. Let's go back in time. Pre-COVID-19, say November of 2019, flu season. Every flu season, someone comes up to me and says, well, I never got a flu shot and I've never had the flu. Well, guess what? That's probably not true. Lots and lots of people have the flu and don't show symptoms. They're asymptomatic, yet they are still very contagious. The same is true with COVID-19. Now let's think about the common cold. Let's again go back to November of 2019. Coworker comes into the office, sneezing, complains about having the cold. You worry, you don't want to catch the cold. So what do? You tick off the number of days it's been since you last interacted with that coworker, knowing that about 4 days ago, that person was infectious, even though he wasn't showing any symptoms yet. That's pre-symptomatic. Let's apply what we've learned about asymptomatic and pre-symptomatic to COVID-19. A study in Nature Medicine showed that most COVID-19 patients were most infectious right before they started to show symptoms. And we know about these silent spreaders, people who are sick with COVID-19 but show no symptoms. They too are very contagious. So while I might feel perfectly healthy today as I do, and I felt perfectly healthy yesterday, and God willing I'll feel perfectly healthy tomorrow, that has no correlation with whether or not I'm infected with COVID-19. So what am I doing? I'm washing my hands, I'm wearing a mask when I go outside, and I'm staying at home.